While the month of May shines a light on many women's health issues, one special topic that should not be overlooked is stroke. The recent death of 52-year-old actor Luke Perry shocked the country when it was revealed that a massive stroke claimed his life. Stroke happens when blood flow to a part of the brain stops or is blocked by a blood clot or plaque, causing brain cells to die. Here in the United States, stroke kills more women than men each year. In fact, it is the third leading cause of death for women, killing almost twice as many women as breast cancer. But many strokes are preventable. Each woman can take steps to prevent a stroke by knowing her risk factors and making healthy changes. May is National Stroke Awareness Month. We talked to Dr. Nitza Alvarez at the Tri-County Heart Institute about what women need to know about stroke.
The first thing that women need to know is that they are at higher risk of having a stroke compared to men. Women tend to live longer than men, therefore we're at higher risk just by age alone. So any woman should be looking for what risk factors they have that increase the risk for stroke. If you're older than 65, your risk for stroke increases. I think that more important than anything that we can do to identify or treat a stroke is how can you prevent a stroke. You have high blood pressure, you know you're at higher risk for having a stroke, therefore you should seek medical attention for that. Do you have high cholesterol? Are you diabetic? Do you live a sedentary life? Around 5 million women live in this country with consequences of stroke. So if you know your risk factors and you are proactive in identifying them, that will help you be away from that statistic. We all hear about my neighbor had a stroke, my family member had a stroke, this person had a stroke. And I know that some of us are capable of recognizing some of the symptoms when a patient had a stroke. I think that is easier when there are obvious signs like I cannot talk, a part of my body is weak, or I have a droopy face, versus more subtle signs of a stroke, which can be like a short-term lapse memory, all of a sudden I didn't remember, or short-term vision loss, where transiently I didn't see well, but then because it didn't last, I didn't pay much attention. Stroke is a lack of blood flow to a part of your brain, and that lack of blood flow can be because of a clot that occluded that vessel, or because of bleeding, the rupture of a vessel that is not letting the blood flow get there. The brain needs nutrients, needs oxygen. It's a very vital organ, and seconds of not having those nutrients or oxygen that needed to be delivered there can translate on death of that tissue, which subsequently gets manifested with deficit that we can see in our patients.
A stroke is an emergency, and it can happen to anyone at any time and at any age. By learning the signs of stroke, you may be able to save a life. Remember this important acronym, FAST. F, facial drooping. A, arm weakness. S, speech difficulties. T, time to call emergency services.
A special note as Hometown Health congratulates Dr. Nitza Alvarez on the publishing of her first book, Heels versus Ties, Living with Your Number One Threat. Written to explain and punctuate the dramatic difference in causes, symptoms, and treatments for female heart conditions versus male heart conditions, the book will be available beginning May 1st in paperback and digital download on Amazon. Next month, we'll talk with Dr. Alvarez about the book and what inspired her to write it. For a link to purchase the book and more information on this month's story, click the Women's Stroke Awareness StoryLink icon at yourhometownhealth.com.